Welcome to the CURES show, where we explore the cutting edge of wellness. I'm Kara Sundlin. Autism cases are certainly on the rise. In fact, they have increased by 500% in New York and New Jersey, and that's, of course, not too far away from us in Connecticut. This is over the last 16 years, according to a study by Rutgers. Dr. Doreen Granpeesheh, I hope I'm saying, I know you told me your last name. I want to make sure, did I get that right, Granpeesheh?
You did. That was great. Thank you so much.
Thank you. Thank you. But you've studied autism and you've helped treat it for the last 40 years. So I know you're one of the nation's foremost experts. So many parents have so many questions, and it keeps changing. We keep learning more. So we're going to take a deep dive. We want to talk about what's going on, not only the latest of treatments, but why we're seeing so much more autism. So thank you for being here.
Oh, thank you very much. It's a pleasure.
So let's start with the why we're seeing more. This study showing 500% increase. Is it that we're just diagnosing it more, or is it really happening more?
Yeah, so I think it's a very small percentage of the reason has to do with the fact that there is more awareness. There's no question that doctors are better trained now to identify, recognize the signs, and diagnose it. But that can't really explain this type of an increase that we're seeing with autism. So generally speaking, the scientific community believes that this is correlated to toxins in our environment. Autism is a genetic predisposition that is triggered by an environmental factor. And the genetic portion has to do with what's called redox, or the ability to detoxify. And if you have a slower ability to detoxify, and that's coupled with all the toxins in our environment, they tend to trigger symptoms in the developing child that we call autism. And mainly the toxin we're talking about is just in our food source, the pesticides that we have in our food, in our soil, and all around us now.
So I know for some, there's going to be, that might be a controversial statement. Oh, it's the toxins, it's because there's so many doctors who would say, well, we don't really know, and it's genetic, and it's all this, and what you're saying is a genetic predisposition. So let's just go down that route for a moment, that let's accept that toxins could have something to do with it. Doesn't that mean that you could do something about it then? Like, what about some doctors really put kids on different diets, and they even do, some functional doctors will do a lot of detoxifying programs for them. What's your opinion on doing that as far as helping?
Right, absolutely. I mean, so here's the problem, I think. One is that, we don't really diagnose autism until the child is roughly around 3 years old. And the effect of toxicity can occur in utero even, right? So the mother could be exposed to toxins, and that will alter brain development in the fetus. But the issue is that, yes, certainly, the sooner you discover that there's something going on with toxicity, and the sooner you alter everything in the environment, whether it's, specific diets, which could, organic diets, farmed diets, foods that are less exposed to pesticides, as well as other things that we ingest, for instance, food coloring and things that tend to be very difficult for children as a whole. If you can place the child on a diet, it is, in many cases, it helps the child kind of wake up and begin learning. But, because it's a little bit later in age, it's like 3 or even 4 or sometimes 5, the child has already kind of missed an opportunity, a window of opportunity to learn as his or her peers would have.
And then we have cases also where we've got Elon Musk and others coming out and saying that they are autistic and obviously quite brilliant. So we do see the strengths in some cases. How do we interpret that?
Autism is a fascinating disorder. I have really enjoyed learning more about it and getting to know a wide variety of individuals, from children to, 50, 60-year-olds who have the diagnosis. And I have to say, there is an element of genius that can be present it's a huge spectrum. So on the one end of the spectrum, you might have individuals who are really heavily affected by the symptoms. They can't communicate at all. And so they have a very difficult time learning and a very difficult time, I would say, surviving in society. Now, on the other end of the spectrum, you have individuals that are just absolutely genius, brilliant. You gave one example. I mean, there are many, and I've met many, many children who had such incredibly unique talents that could have gone missed. Like we could have not noticed them just because, for instance, the child might be nonverbal, but they have like a brilliant memory and they can draw maps and sequences of things that they've seen in their lives. And so it's a very fascinating disorder. And it's important, I think, to remember that when you meet an individual with autism, not to jump to conclusions about what they're capable of, because really, the more I get to know these children and adults, the more astonished I am by the things they can accomplish.
And you've been doing this for quite a while. In 1987, contributed to one of the first major autism treatment studies. In 1990, you established your Center for Autism and Related Disorders, or CARD, which you've had a lot of experience. So bring us up to date right now. What do you think works best? What's cutting edge treatment for autism right now?
Yeah, that's a great question. So the only real treatment that has been approved and is now covered by health insurance is a therapy called applied behavior analysis, or ABA. And this is essentially, it's a kind of teaching technique. It's a behavioral psychology teaching technique that has to do with, we're going to assess the child. We're going to identify what areas they are deficient in, like is their language behind, their social skills, and so on. And we're going to teach those very rapidly, kind of like intensive tutoring. And also, we're going to teach the child to not use challenging behaviors to communicate. A lot of the kids, as you can imagine, are frustrated because they can't vocalize their needs or their frustrations and so on. So they develop challenging behaviors, like they will tantrum or aggress in order to communicate how they feel or what they want. And through ABA, the children are taught how to communicate using vocalization or icons or some more adaptive form of communication. So ABA is what is the kind of most accepted and funded source of treatment. But we really believe that this is, also a medical issue. And you see so many children who don't sleep. They have lots and lots of gastrointestinal issues. In fact, there's been a lot of scientific publication on this issue that there's a high correlation with GI issues. So our belief is that you have to first focus on making the child healthy. You have to stabilize them medically. So the child should be able to sleep well. They should feel good enough to be awake and aware and be able to receive this intensive form of behavioral therapy.
And you mentioned the gut issues. I mean, that's becoming more and more, certainly functional doctors have been working on this for years, but it's becoming more mainstream of the gut-brain axis, that when there's problems in the gut, that's where the neurotransmitters are made, and that affects the brain, and vice versa. So back to your original of detoxifying, parents are desperate. They'll try anything, but it's also very difficult when you have a child who maybe only wants to eat 3 things or 4 things, and that might be gluten and dairy, so what do you think it's worth it, and what do you recommend for helping to heal those gut issues as far as having an impact on the other symptoms?
Yeah, what a fantastic question. Yeah, it's a little bit difficult, and it's also not for every child. This is kind of what's important. Fortunately, nowadays it's pretty simple and easy to get an idea of what the child's food sensitivity issues are. But I think, it was discovered many years ago that a majority of children on the spectrum will have some sort of inflammation. and when in their gut. And when they have inflammation, we're looking primarily at things like gluten, which is the protein in whole grains, casein, which is the protein in dairy products, and then also things like corn and soy and food additives and colorings and those types of things. Yeah, it's difficult, I think, for parents in the beginning because they, as you said, I mean, I've had children who've come in and the parents will say, oh, the only thing he drinks is like, 10 cups of milk or chocolate milk or something like that. And they're very concerned about taking that away. So again, this is one of those things that if you are in an ABA program, your team of therapists will actually help you with this type of thing, where you gradually will take those types of foods away and you will gradually replace them. In fact, ABA therapists are also trained to do what we call feeding therapies, which have to do with broadening the child's diet and helping them take in foods that are healthier for them. I've seen, honestly, like incredible changes, and I'm a behaviorist myself, so I'm not biased towards this. If anything, I'm biased against it, but I've seen such incredible changes with children where I'll see them the day one and they have very dark rings around their eyes and completely self-isolating and not interacting, no eye contact. And parents will take the child off just milk, for instance, just casein. And within a couple of weeks, the child is much more engaged and involved, and the dark rings are gone, and they're focused, and then they're open to learning more. So although it's difficult, it does have an effect on children and some children. And I think it's definitely worth doing just to see how it changes your child's learning abilities.
So what would be a protocol if you want to try that?
Oh, well, so first we always start with casein, right? Because that's easier than gluten and it has a much faster effect when you take the child off of milk. And essentially, a simple way to do that is you just start watering down the milk that they're drinking, right? These days, we're so fortunate we have all these other types of milks, which, of course, 10 years ago we didn't have. And you have to be careful depending on the child, because some children are also allergic to soy, or boys shouldn't necessarily be given a lot of soy milk. So we will replace the dairy with other things, for instance, with just water to begin with, and gradually with potentially other types of milks that are not harmful, maybe rice milk or oat or whatever. And it's a pretty easy process, to be honest, because the child barely notices it. And, if the child does notice and reacts, then all you have to do is you have to reward it with some other food item or activity that they like. This is all, ABA is all based on reinforcing certain behaviors so that those behaviors increase. So once you've done that with casein, you have to wait at least a week, maybe 2 weeks before you can see a really strong reaction or improvement. With gluten, it's a similar process of gradually shaping and removing certain foods and adding other foods, but it takes a little bit longer, and it takes, I would say, roughly a month before you can see if there's a significant difference. One of the things that parents report pretty rapidly is sleep change, and that sleep improves when the child is on a healthier diet. So, it's a process. It takes a little bit of time, but it absolutely is worth it.
And just to clarify, it wouldn't be just removing milk. Like if they like to eat pizza, we're talking dairy in general, right? No cheese, no. So it's the other things of really being dairy-free. Yeah, okay. Yeah. But I have interviewed families where they've said it's made a big difference. I think I know I have a son who's sensitive for sure, probably because I am, and it's difficult. He's a teenager. So he, trying to tell him to not eat stuff is like a whole nother battle, even though I can see the rings and he'll say he's tired. I'm like, those are allergic shiners. That's just one thing you mentioned. If parents don't realize, sometimes those dark circles, especially if they are sleeping, that is sometimes called an allergic shiner. It's an indication they're eating foods that might be bothering them, right?
That's absolutely right, yes. And I can see that you've kind of gone through it, and so you're pretty experienced with it. But yeah, it is difficult with food because, food, it provides immediate reinforcement, right? You're eating it and you feel really good right now. Whereas later, maybe an hour later or so, you might feel bloated and have pain and that sort of thing. And immediate reinforcement will always outshine delayed reinforcement, you know. So
Okay.
people tend to eat foods that they enjoy, but then they regret it later.
Yep. Okay. So, so we talked a little bit about diet. What about medications, either supplements or prescriptions, that you think are effective and worth it for parents to notice a difference?
Yeah, that's a very, very important part. So there are a number of different medications that are being used, let's say, in this field. Really, the medication that has been approved, you know, by the FDA is kind of Risperdal, for instance. It's an antipsychotic, and it's not a medication that I would recommend unless the child is very severe and has a lot of, like, let's say, self-injury or harmful behaviors that are very difficult to get under control. That being said, there are a variety of other medications that I have seen have significant effect. As you mentioned earlier, you know, autism does have a correlation to the production and use of neurotransmitters in our body. And one of those neurotransmitters that has a very important role in autism is serotonin. And there are a lot of medications that control serotonin intake in the body. These are mostly known as antidepressants, right? They're actually called selective serotonin reuptake inhibitors, SSRIs. And there's a whole bunch of them. There's many different types. Those medications tend to help some children because there's a portion of autism that one of the diagnostic symptoms of autism is kind of wanting and insisting on the same type of thing, or repetitive stereotypical behaviors that very much resemble obsessive compulsive behavior, right? OCD. And so these SSRIs help the patients, the children with autism, have less of that obsessive need. And so then they are less kind of concerned about, let's say, lining up their objects or, you know, doing something in a routine, and they have less of a hard time with transitions and with new situations. And so they start to learn a little bit better. So SSRIs are one category that work. Another category, of course, are stimulants. And just like children with ADHD, in some cases, stimulant medications will also help children with autism pay attention better, focus better, and therefore, again, learn better. So those are the kind of the majority of the, I guess, you know, prescription medications. Now, what I really recommend, and you mentioned a few times, you know, seeing a functional medicine physician will really help, because through blood tests and urine tests, we discover a lot of different supplements that might help the child, that might be low, that, you know, various chemicals in the body that might not be functioning correctly or might be low, and then it becomes appropriate to do supplementation. Every child is different. Every child will benefit from different types of things. I will say that a common area, again, as I mentioned before, is sleep disorder. And so I think getting together with a physician or a functional medicine physician who can help you with your child's sleep is vital, because honestly, some of my kids, they have such horrible sleep. I can't imagine how they're functioning during the day. And when we fix the sleep, they just learn so much faster and they're so much more aware. Just like the other stuff, like if you have gastrointestinal pain and we help get rid of that, then the child is much more likely to function, thrive, and learn.
Yeah, and the sleep, I know from doing this show for so many years, sleep is always any doctor's drug of choice. So sleep matters, right? So sleep and nutrition, the low-hanging fruit. But it can be difficult, especially for kids on the spectrum. And you mentioned, you know, a lot of people, I think, are going to their pediatrician. And I get asked this by moms all the time, like, I don't know if the medication is right. And not just for autism, but say ADHD or whatever. Do you think it's important that people, when they're trying to figure out what's best, because it is so individualized, that they see more of a psychiatrist, someone who's going to be really skilled in this?
Yeah, I think pediatricians are mainly trained to diagnose at this point, which wasn't even really the case like 20 years ago or 30 years ago. And I think once you have the diagnosis, I'm not even sure that you're looking at psychiatrists, but some psychiatrists and certainly some psychologists are specialized in autism. For example, myself, I've been doing work in autism for over 40 years, and that's pretty much all I've worked in. And I think it's important to find people whose specialty is autism and to actually kind of get an overview of the different areas that you should be looking at. For example, with me, with my patients, if I know the patient is developing, for instance, seizures, obviously I'll start working very quickly with a neurologist. If I see a lot of gastrointestinal issues, I'll start initially with a functional medicine physician, do dietary interventions with a nutritionist. If that doesn't work, I am going to go see a GI specialist for the child and try to get together with them. You just keep kind of going more and more specialized until you can figure out exactly what the issue is for your child and help alleviate that. You focus more on all the different things that are going on rather than the diagnosis of autism, right? Because if you can make the child feel better, then their brain is going to be more awake and they're going to learn a lot better through their behavioral therapies.
Yeah, and speaking of, I know you work with people. You are coming to us from Los Angeles right now, but you've had experience in lots of places. If people are here in Connecticut, what's the best way to find a specialist?
So I think the best way to go is to contact your health insurance first, because your health insurance will actually have centers that specialize in autism listed for you. And then that way you will, from the very beginning, you'll be covered. That's pretty important because these types of therapies are very intensive and long-term, right? ABA, for instance, for a young child could be 40 hours of one-to-one therapy per week, and it could go on for 3 years. So it's important to get your health or medical insurance involved as soon as you can so that your path is financially covered.
You mentioned ADHD also. I mean, autism is a spectrum, and we're learning, all these different, where people are on it, and over time, Asperger's is no longer an appropriate term. It's now just on the spectrum and different things. But these links of, there are plenty of kids with ADHD who also have, say, the sensory processing disorders, that get very irritated or become sensory seekers. Can you shed light on that? I mean, I know that some parents might be going to an occupational therapist, or how do I deal with giving them a sensory diet so they can react well in school or deal with some of the frustrations and the outbursts?
Yeah. So if you don't mind, I'll just go back to the diagnostic criteria because that's, I think, very important. So autism has two basic areas that are affected. The first area is what we call social communication. And within that area, you need to have at least 3 symptoms. And the symptoms would be things like no language or delayed language or delayed nonverbal communication, which would be things such as eye contact, or let's say a deficit in developing social relationships. That would be a symptom. So that's kind of one area that has to exist. The second area is what's called restricted repetitive behaviors. Behaviorists will often refer to this as stereotypies, because a lot of these behaviors are things that are stereotypical and kind of repetitive, and you can't really figure out why the child is doing this. They just repeat the behavior, whether it's a body movement like rocking or finger flicking, or it's something like lining up their toys or looking at fans that are circular. It's kind of a repetitive type of behavior. In that domain of restricted repetitive behaviors, many years ago in the diagnostic manual, we also added a symptom, which is hyper or hyposensitivity to environmental stimuli, right? And that's where your question comes in, which is the sensory portion of it. I would say, I mean, I don't know the exact numbers, but a lot of children who have a diagnosis of autism do have sensory sensitivity. So for instance, they might lights in a room will be very harsh for them, or they might even hear sounds that we don't even hear. For example, they'll walk into a room, and a lot of schools, as we know, still have fluorescent lighting, and the child actually will hear the sound of the fluorescent bulbs, whereas we don't even hear that sound. And that is super distracting to the child, and over time it can actually be very upsetting to the child. So, what do you do in those types of situations? I advise parents to do a combination of things. So one is, yes, you talked about sensory integration, which is a type of occupational therapy. And certainly you can work on where you are exposed to various sensory experiences. It's kind of like trying to normalize your sensory input through these occupational therapy activities. So yes, certainly if you have issues with sensory input, it might be helpful to do occupational therapy a couple times a week. That is one thing. The other thing, though, is you can certainly do things that accommodate your child. We've come a very, very long way over the past, 40 years or so. Now, many movie theaters will have what's called sensory sensitive or sensory friendly, let's say, Fridays. So every Friday, the sounds and the lights in the movie theater are dimmer so that children or adults with autism can go to the theater and enjoy it as well. So there are lots of environmental accommodations. If you have a child in school, you can certainly talk to the school, request an individualized education plan where they focus on accommodating your child and making sure, for instance, they're not sitting next to a window where the tree leaves are distracting them, or they're not sitting right underneath a light that's bothering them. Or, for example, I had a child who was extremely anxious in school because the buzzer that would go off in between periods was extremely distracting, and he was just terrified that this buzzer is going to come. So the school changed it. So those types of things help. In some circumstances, obviously, if you're going, let's say, to a party or a mall or something, you have to accommodate, right? So I tell a lot of parents, take with you noise canceling headphones. So your child actually has a way of self-soothing. If they're having a difficult time with an environment, they can always go sit in a corner, play their headphone, put something on that calms them down, just like we do, right?
Yeah.
Just like when we're overwhelmed, we might do some form of meditation or breathing or something that will calm us down. We just have to be aware that our kids on the spectrum have those types of issues and help them develop tools to overcome those situations.
Dr. Granpeesheh, we were so happy to have you here, and I've only got 30 seconds left, so I'll let everyone know again, you helped create the Center for Autism-Related Disorders. Any place people should follow you so they can get more information?
Thank you so much. Yes, I actually have a podcast every week on Tuesday mornings, and you can Google me, DoreenGranpeesheh.com. My podcast is called Ask Dr. Doreen. People call in live, and I answer questions all the time, so I'm happy to do that. And thank you so much for having me. It was wonderful being here.
Thank you, Dr. Doreen. I'll let parents look for that. And thanks everyone for being here. You can follow me at KARAS for more information on the cutting edge of wellness. Have a great day and be well.